Hi, everyone, and welcome to week 8. This is our last week. It is hard to believe that the semester had gone by so quickly. This week, we are going to be talking about intentional and unintentional injuries. You will talk about the epidemiology of unintentional injuries, when, where, and to whom these injuries occur. You will learn the strategies for prevention and controlling the unintentional injuries, the scope of occupational safety and health in the United States and the importance to community health, and then describe some broad strategies for preventing injuries in the workplace. You'll give some differences between occupational injuries and occupational diseases and be able to give examples of each. And then lastly, explain the purpose of worksite health and wellness promotion programs and describe some of their features. The specific items that are due this week are the Triangle Fire blog. There is a brainstorming safety wiki, chapter 15 and 16 quiz, your discussion board, and your advocacy letter. The purpose of the Triangle Fire blog is to conclude the events that led to the Triangle Fire and to gain a better understanding of the historical events that led to the workplace safety regulations. There is a video on Blackboard about the Triangle Fire, so view the video. And then after viewing the video, you are going to address what events do you feel led to the Triangle Fire, and then how specifically did this event contribute to the workplace safety regulations that we have today. The next assignment is brainstorming safety, and this is a wiki. The purpose of this assignment is to allow you to research the different ways that Harper College creates a safe environment for you, and then to evaluate the different notions of safety at college. For this assignment, you are going to use Harper's website to discover ways Harper creates a safe environment for students. And then you can see I provided the link to the Harper College website, although I'm sure you can find it on your own. And for this wiki, I would like you to list and describe at least 3 ways Harper creates a safe environment for students. As you create this assignment, try to read what other students have said and not repeat what they have already created or written. This brings us to chapter 15. Some of the vocabulary words for this chapter include injury, which is physical damage to the body resulting from mechanical, chemical, thermal, or other environmental energy. Unintentional injuries is an injury that occurred without anyone intending harm. And then unintentional injury, which is an injury judged to have been purposefully inflicted either by the victim or by another person. Injuries can be very costly to society. It is the leading cause of death and disability in the world. Over 5 million people die from injuries each year. Fatal injuries are injuries that result in 1 or more. And disabling injuries are injuries that cause any restrictions to normal activity beyond the day of the injury's occurrence. So for example, if I cut my finger, then maybe today I'm not able to write, but my activity is able to resume. That would not be considered a disabling injury. Unintentional injuries are the cause of nearly 2/3 of all injury-related deaths in the United States. The major types of unintentional injuries include poisonings, motor vehicle crashes, falls, and other types of unintentional injuries. Poisonings are the leading cause of unintentional injury death in 2014, so the data is a little old, but the unintentional ingestion of fatal doses of medicines and drugs tends to be the #1 poisoning. Also, the consumption of toxic foods, generally foods that have gone bad, and exposure to toxic substances in the workplace or elsewhere. Most poisonings, however, occur in the home. Motor vehicle crashes are the second leading cause of unintentional injury death. The majority of those that are killed are either drivers, passengers, motorcycle riders, pedestrians, and pedal cyclists, which are bicycle riders. Falls are the third leading cause of unintentional injury death. It is the leading cause of injury-related medically consulted injury, meaning people will consult doctors and lawyers after a fall. Most falls occur in the home, and they disproportionately affect the elder population. Alcohol and other drugs as risk factors. Not surprisingly, alcohol and drugs are huge risk factors for unintentional injuries as they contribute to these injuries. They are also involved in a high number of motor vehicle crashes as they're related to speeding, seatbelt use, and other behaviors that result in a motor vehicle crash. We look at prevention through epidemiology. This triangle should look familiar as this was discussed when we looked at the epidemiological triangle of infectious disease. So there's a similar one for unintentional injury, and it's, again, three sides: energy, host, and environment. Host is the person, the environment is where this occurs, and the energy is the producing agent. Is it being burned by hot water? That would be the energy. Is it ingesting too much NyQuil? That would be the energy. So the energy is that producing agent. Is it being in a car crash from speeding? The speeding would be the energy. And so when looking at ways to reduce unintentional injuries, one of the ways that community health officials try to reduce the risk is by looking at this energy component. And so by reducing the risk factors in energy, you're reducing unintentional injuries. For example, lowering speed limits. That results in less speed, less crashes. Putting down the temperature on the water heater results in less burns at home. Other prevention and control tactics based on that model. And so again, produce the accumulation of an energy producing agent, also to prevent an inappropriate release of excess energy, sometimes placing a barrier between the host and the energy, and separate the host from potentially dangerous sources of energy. Placing a barrier between the host and the energy could be wearing a helmet. So you're separating the hard impact of a fall by putting a helmet on the head. Community approaches to prevention of unintentional injuries. One of the most effective campaigns can be an educational campaign. So the process of changing people's health directed behavior through education. This could be seatbelt use, wearing a helmet when riding a bicycle or wearing a helmet when riding a motorcycle, reducing speeds. Those are educational campaigns. Then there's regulation. Now these are enacting and enforcing laws to control conduct. So not only telling people to wear their seatbelts, but now pulling people over and giving them a ticket if they're not wearing seatbelts. Then there's automatic protection. So these are modifying products or environments to reduce the risk. For a while, there were cars that had automatic seatbelts. So when you close the doors, the seatbelts would automatically come across your lap. That would be an example of an automatic protection. And then litigation is seeking justice for injury through courts. So if there is a faulty product, that the people come forward and then they litigate through courts. It doesn't prevent the injury, but it hopefully gets compensation for the injury, but then also teaches companies a lesson so that in the future they do not try to hide from any potential dangerous products. Intentional injuries are from self-directed or interpersonal violence. So these are obviously intentional. And this is a large community health problem in the US. And I would even say a larger problem more recently. The types of intentional injuries include assaults, rape, suicides, and homicides. They can be perpetrated against family members, community members, or even complete strangers. And it's very costly for society due to loss of life, loss of productivity, and economic cost to communities. Now, the epidemiology of intentional injuries is a little bit different. Interpersonal violence disproportionately affects those who are frustrated, those who are hopeless, jobless, living in poverty, and those with low self-esteem. Generally, more acts are committed by males. Firearms are increasingly involved. Alcohol and drug use contributes to this problem. And those that are perpetrators are more likely to have been abused and neglected as children or have been exposed to violence as children. So at one point in their life, the perpetrators have also been victims. In terms of suicide and attempted suicide, the suicide rate for men is 4 times that than for women. The suicide rate for young people has increased between 2009 to 2013 to its highest rate in 10 years. Again, these numbers are old. I would suspect that the rates in current years have been the highest that they've been in a long time due to the COVID, due to isolation, and due to fear. Suicide rates for elder men are highest for any population subgroup. In terms of firearm injuries and injury deaths, so for both intentional and unintentional injury acts, firearms are the 3rd leading cause of death. It's the highest risk for homicide and suicide involvement for teenage boys and for young men. There have been a problem with guns on college campuses. And there is this absence of a detailed federally supported reporting system involving gun use. So what are some resources for prevention? We need to look at resources for individuals and violence, for family violence and abuse, and this includes child maltreatment, child abuse, and child neglect, elder maltreatment and prevention, and then of course, intimate partner violence. Moving on to the next chapter, so chapter 16. This is talking about occupational injuries. So each year there's about 317 million non-fatal occupational injuries and over 300,000 fatal injuries. So after being at home, Americans spend the majority of their time at work. And occupational injuries fall into 2 categories, or really there's 2 categories here. Occupational disease, which is an abnormal condition other than an occupational injury that's caused by exposure to an environmental factor associated with employment, and that leads to occupational illness. And then there's occupational injury, which is an injury that results from exposure to a single incident in the workplace. Industry is a subset of a larger community, and so that's why occupational health is considered part of community health. It affects the workplace, but also those outside the workplace. And workers themselves tend to form a community. We have the Occupational Safety and Health Act of 1970, the OSHA Act. And the purpose of the act is to ensure employers in private sector furnish each employee at a workplace free from recognized hazards causing or likely to cause death or serious physical harm. And then the Occupational Safety and Health Administration, OSHA, was established to enforce this act. Well, unintentional injuries in the workplace. We have minor injuries such as cuts, bruises, abrasions, and minor burns. We have major injuries such as amputations, fractures, severe lacerations, eye losses, acute poisoning, severe burns. And these are reported by many sources. Then there's fatal work injuries. The leading cause are those that are transportation incidents. So if you work for a company where you're involved in transporting goods, peoples, or services. And then industries with the highest rate of fatal occupational injuries include agriculture, forestry, fishing and hunting, mining, construction, and then transportation and warehousing. Fatal occupational injuries by industry. So logging is the single most dangerous occupation. The second highest is mining. So we look at prevention and control of unintentional injuries in the workplace. There are 4 fundamental tasks. Anticipation, so think ahead about what may cause the problem. Recognition, recognizing what are some problem areas. Evaluating the problem areas, and then controlling. So in workplace violence, this is intentional workplace injuries. 1.7 million victims each year. Homicide, 4th leading cause of workplace fatalities. And so there are a few categories for workplace violence. There's criminal intent, which is considered type 1. Customer client is type 2. Worker on worker is type 3. And then personal relationships is type 4. And there are some risk factors to being involved in workplace violence. One is working with the public, working around money or valuables, working alone, working late at night, and then jobs with higher risks tend to be taxi cab drivers, jobs in liquor stores, and detective and protective services. Occupational illnesses and disorders. Illnesses are a little more difficult to acquire data on than injury. It's difficult to link occupational exposure to an illness because many conditions are slow to develop, and it's difficult to associate that condition with some sort of exposure to a workplace. It's not as if there is some glowing toxic substance at work and then the next day you get some weird cancer. Cancers are slow to develop, and it's difficult to ascertain what exactly contributed to that development. Other workplace-related diseases and disorders include poisonings. These are more common amongst agricultural workers. Infections, which are more common amongst workers in the healthcare industry. And then exposure to hazardous drugs. And then we look at prevention and control of occupational diseases and disorders. It really requires vigilance of the employer and the employee. So it's a shared responsibility. You can look at the agents, post-environmental model, so the epidemiologic triangle. And examples of activity include identification and evaluation of agents. This is infectious agents. Setting standards for the handling and exposure to causative agents, so anything that has a risk associated with it, whether it's an infectious agent or whether it's an agent if exposed to skin can cause damage or if inhaled can cause damage. Having some engineering controls, continually monitoring the environment for safety, and then continually offer medical screening to ensure that people are remaining safe and healthy. And then there are occupational safety and health professionals. But their job is to maintain health safety standards in the workplace. Now, the ones that are mentioned here are either government jobs, so you can go in and evaluate the safety of certain workplaces, or you're hired by the companies themselves to ensure that your company is upholding standards. And so these professionals include safety engineers, certified safety professionals, health physicists, industrial hygienists, occupational physicians, and occupational health nurses. And then lastly, there are some workplace health and wellness promoted programs. There's Total Worker Health, and these are policies, programs, and practices that integrate protection from work-related safety and health hazards with the promotion of injury and illness prevention efforts to advance worker well-being. That's a lot to say. And they're more common are employee assistance programs, and these are work-based programs that assist employees who have substance abuse or domestic, psychological, or social problems that interfere with their work performance. Employee assistance programs will offer social work, counseling. They could offer some legal aid assistance to help employees with their work-life balance. This concludes our last week's presentation in PowerPoint. Feel free to contact me if you have any questions.